This is our second joint Epilepsy12 Open UK annual conference. Last year's was absolutely fabulous, gave us lots of food for thought and fertilised lots of discussions. And this year, I think that the vibe and the energy from everyone in the room has been really brilliant. And I'm sure that this is going to fuel another year's excellent quality improvement in the UK.
It was really important for us all to attend here as a team today, as we've put a lot of work into doing our audit together, and it's really useful to get updates on what's going on to improve our clinical practice.
Epilepsy care for children is going through a radical change across the country, and I think we've come out with newer initiatives to improve the lives of children with epilepsy and their families. And I think this is a formal forum for us to join together, to work together to make differences to children and their families.
So it's really important for us as a team to be applying for a place on the QI because of all the support services that we can bring into that role as well. So it's not just the medical teams, it's all the other agencies that work behind the scenes, if you like, to make sure that we're all available to support our families.
The highlight of the conference today has probably been the children and young people's presentation, because everything we do needs to be grounded in making things better for children and young people. Last year we heard about their desperate need for improved contactability, and this year they've come to us with the absolutely brilliant idea, although difficult to say, of the clinic chat checklist, so that we're excited that they're basically going to be finding out about our services and then giving us some tips about how we can do things better.
We give a lot of consideration to reasons why treatment does not work, and we think very much about the diagnosis of epilepsy, the causes of epilepsy, and what the treatment options are when two good drugs have not worked that should have. But perhaps we don't think enough about the reasons why a drug might not be taken, and that is an absolutely essential part of the question for children and young people, because how often do we give that drug? Do we ask them to take it once, twice, 3 times a day? Are there side effects of that drug? What are the implications for them? And when we devise plans for treatment, are they plans that are reasonable and sensible in a child or a young person's life?
So I think the topics for today's programme have been absolutely fantastic. Really happy to hear from the children and young people, and also really excited to see all of the presentations about QI projects that have happened around the country, around valproate, around the economic value of epilepsy nurses.
Going forward, I really do hope and believe that Epilepsy12 and Open UK will continue to help us to improve and deliver our services for children and young people with epilepsy.